Welcome to our Watch Before Surgery series. In this video, we will be visiting a patient who's experiencing nerve root irritation. This is one risk associated with spinal surgery with side effects occurring in 1 out of 7 patients, or about 15%. Listen to the patient and hear what they have to say about their experience.
What were your symptoms before the surgery?
Low back pain. Pretty much like the wind was out of my sails.
Yeah.
Didn't want to do too much of anything because everything hurt all the time.
How long did you have the pain?
Years.
Years.
Yeah.
Pain was in the back and the legs. Can you describe it where it was?
Down the back of my legs into my feet.
Into the feet. 1 to 10. How bad was the leg pain?
Sometimes 9.
9.
Yeah.
Okay. Now the surgery, we did a surgery for you not even a year ago, maybe about 10, 11 months ago.
Mm-hmm.
We did actually, this is what we did. We fused the bottom two discs, we took the bad disc out, put a spacer in and put spacers. And we did a transcameral olive procedure. Do you remember how long you stayed in the hospital?
1 night.
Just 1 night?
Yep.
When did the leg pain go away?
Immediately.
Immediately. Now, obviously, sometimes every surgery comes with some side effect, with some risk profile. And before the surgery, do you remember we talked to you about that there is a risk of nerve irritation, even weakness?
Yep. You made me feel comfortable though, so
Yeah.
I was comfortable with it.
Because that's exactly what you had. You had a weakness on the left foot. You couldn't bring it even up right after the surgery, which is sometimes happen. And I'm just going to check it. Can you put your foot in front of you? Push up. Yeah, push down. Excellent. That's a full strength. So it completely returns. So it has a very good prognosis. But sometimes it happens. What do you remember? What we told you about that nerve irritation and even
That
weakness?
it was just probably irritated nerves, and they take a while to be calmed down.
Yeah. Do you remember that we talked about that the 15% of the people may have some nerve irritation, rarely as well, weakness. So generally we consider that risk, especially for the lower lumbar spine, 15%. But the vast majority of the cases after 4 to 8 weeks start improving. In our study, only 1 person in 303 patients after a year still had some weakness there. But generally, in open surgery, that risk has been reported. The lowest reported rate for that same problem in the open surgery, the lowest reported is 0.3, like us, but it has been reported as well all the way up to 5, even 10% in some studies. So we have the lowest reported rate, but it's still a surgery, it still has some effect. It's just the idea is to communicate with the patient that these things sometimes can happen.
Right. Best thing I can say is just keep walking.
Yeah.
Walking is the best thing and gets rid of all the problems.
So how is generally, how bad is your pain now?
Sometimes if I like when I had COVID a ways back and I was laying around a lot.
Yeah.
And not moving like I should be, that kind of seemed to settle in my spine, the cold did. And so it hurt a little bit more then. But if I'm doing my normal work and stuff, it's probably maybe around a 3.
3.
And way better.
Yeah, way better. Now, how is your daily activity now?
The only thing I do have a problem with is trying to get my socks on, but that's probably because I need to lose a little weight too.
Okay.
But I have a little way of doing it, and it's just kind of funny. But
well, overall, happy with the results so far?
I'm 100% happy.
Excellent. Well, thank you so much for the interview. I appreciate that.
Yep.